was a speaker at the virtual public event in the margin of 13th Conference of State Parties to the Convention on the Rights of People with Disabilities in December 2020. Organized by CARE, Community Association for Vulnerable Persons, National Union of Women with Disability of Uganda, and Women's Enable International, co-sponsored by Permanent Mission to Mexico to the UN, Permanent Mission of Ireland to the UN and UNICEF. We have known for years that people with disabilities are often excluded from programs and services designed to prevent and respond to gender-based violence in humanitarian emergencies. More recently, with the onset of COVID-19 and the gender-based violence shadow pandemic it has triggered, women and girls with disabilities are being left out and left behind in even greater numbers. They may be isolated in their homes, overlooked during need assessment, and not consulted in design or evaluation of programs. But global pandemic or not, all human rights of women and girls with disabilities must be ensured, and particularly protected to those in humanitarian crisis must be guaranteed. This event brings together women who are at the front lines in Cameroon, Uganda, and South Sudan, addressing the intersect between gender, disability, gender-based violence prevention, and humanitarian response. Through a moderate discussion, these women's first-hand experiences about the key challenges they face were heard, and what approaches are working and what need to be changed or scaled up to ensure we deliver on our collective commitment to make access to gender-based violence services, mental health, psychosocial support, sexual and reproductive health services and programs available all on an equal basis. There was also an opportunity for participants to pose their own questions to the panel. The objective of the event was to provide an international platform for local disability rights advocates working in range of countries experiencing humanitarian emergencies to talk directly with the state parties to the CRPD about the challenges that women and girls with disabilities face in these contexts, particularly when it comes to gender-based violence, prevention and response, and access to the highest attainable standards of mental and physical health, including sexual and reproductive health services. The speakers provide recommendations about how these challenges can be overcome to advance commitments to inclusive humanitarian action and inclusive and gender-responsive sustained development. By promoting a better understanding of the challenges local women-led and women rights organizations are experiencing both pre- and post-COVID, provide concrete recommendations to the humanitarian system and the state parties to the CRPD to ensure all stakeholders take actions to put women and girls with disabilities in the center of humanitarian action, both as agents of change and members of affected communities. To showcase the tools of having been developed to address the intersects between gender, disability and humanitarian response, including the IASC Disability Guidelines, Minimum Standards for Prevention and Response to Gender-Based Violence in Emergencies, and the VRC-IRC Toolkit for Gender-Based Violence Practitioners. Participants include UN permanent missions, experts on gender and disability rights from member states that are parties to the CRPD, UN officials and staff, civil society representatives from national, regional, and international non-governmental organizations.
Please subscribe and join hands with us to make nothing about us without us.